Doctor, if you stick a needle into my tumor, won't the cancer just spread? It is one of the most common anxieties patients bring into the clinic, and it sounds entirely logical. To understand where this fear comes from, we have to look at what a biopsy does. A doctor slides a hollow needle into a mass to extract a sample, but as the needle pulls out, people worry stray cancer cells might scatter along the exit path. This known theoretical concern is called needle tract seeding. The mechanics of the idea make perfect sense when you picture it in your head, but to see if those stray cells actually survive and grow, we need to look at the clinical data. Every single year, millions of biopsies are successfully performed in hospitals all across the globe. This grid represents decades of medical research tracking thousands of biopsy procedures. When scientists comb through this massive dataset to look for biopsy-related cancer spread, they find it almost never happens. Out of thousands of patients, only a fraction of a percentage experience it. The mathematical reality of the data shows that this pervasive, everyday fear rarely materializes in the real world. The reason it doesn't happen is that modern biopsy techniques are actively engineered to trap those cells and minimize physical risks. Before a needle ever touches the skin, doctors map the safest route using real-time imaging guidance, like an ultrasound or a CT scan. Watching a live feed allows the physician to guide the needle with absolute pinpoint accuracy, ensuring it only interacts with the necessary target tissue. This graphic highlights the few documented exceptions. Needle tract seeding has been reported in a small number of specific liver, kidney, and soft tissue cancers, but oncologists anticipate these exact scenarios. When they suspect one of these high-risk tumors, they utilize specialized, isolated biopsy methods that shield the tissue on the way out. The medical field does not ignore the risk of spreading cancer. Instead, specialized preparation and technology actively neutralize it before the procedure even begins. Without a biopsy, a tumor is a complete unknown. Without examining that tissue, doctors are forced to guess what they are fighting, which is incredibly dangerous. Extracting a sample eliminates uncertainty. It tells the medical team exactly what they're dealing with. Identifying the exact cancer type is the only way a doctor can safely prescribe highly targeted, life-saving chemotherapy, radiation, or surgery. This comparison shows how the medical community weighs the decision. For the vast majority of patients, the guaranteed benefits of getting an accurate diagnosis easily outweigh the microscopic theoretical risk. A biopsy does not usually spread cancer. Conquering the fear of the procedure is essential, because getting the right diagnosis early is ultimately what saves lives.